Namaskar. My name is Dr. VIDYAPEETH, Professor, Department of Chikitsa, Faculty of Ayurvedic Sciences, JAYOTI VIDYAPEETH Women's University. In today's session for class BMS 4th year, I am going to take session regarding the disease tetanus. Let's start the topic. First of all, a general introduction regarding tetanus. As you know, tetanus is a fatal bacterial infection. Causative agent is Clostridium tetani bacteria. Bacterial spores usually enter the bloodstream through a cut or deep wound. Clinical features are fever, sweating, elevated blood pressure, spasm and stiffness in jaw muscles. This is a specific sign. Stiffness in neck, abdominal muscles, painful body spasm triggered by light, noise, or physical touch. Complications associated with this disease are respiratory failure, pneumonia, broken bone. Sign and symptoms. Tetanus often begins with mild spasm in jaw muscles, also known as lockjaw or trismus. Spasm can also affect the facial muscles, resulting in an appearance called risus sardonicus. Chest, neck, back, abdominal muscles, and buttocks may be affected. Back muscle spasms often cause arching called opisthotone. Sometimes the spasms affect muscles that help with breathing, which can lead to breathing problems. Prolonged muscular action causes sudden, powerful, and painful contractions of muscle groups, which is called tetani. These episodes can cause fractures and muscle tears. Other symptoms include fever, headache, restlessness, irritability, feeding difficulties, breathing problems, burning sensation during urination, urinary retention, and loss of stool control. Now, incubation period. Incubation period of tetanus may be usually up to several months, but is usually about 10 days. In general, the farther the injury site is from central nervous system, the longer the incubation period. The shorter the incubation period, the more severe the symptoms. In neonatal tetanus, which is known as trismus nascentium, symptoms usually appear from 4 to 14 days after birth, averaging about 7 days. 4 types is usually it is classified as generalized, neonatal, local, and cephalic. Generalized tetanus is most common type of tetanus, representing about 80% of the cases. Generalized form usually presents with a descending pattern. First sign is trismus or lockjaw and facial spasm called risus sardonicus, followed by stiffness of the neck, difficulty in swallowing, and rigidity of pectoral and calf muscles. Other symptoms include elevated temperature, sweating, elevated blood pressure, and episodes of rapid heart rate. Spasms may occur frequently and last for several minutes, with a body shaped into a characteristic form called opisthotone. Spasms continue for up to 4 weeks, and complete recovery may take months. Neonatal tetanus. It is a form of generalized tetanus that occurs in newborns, usually those born to mothers who themselves have not been vaccinated. If the mother has been vaccinated against tetanus, infants acquire passive immunity and are thus prevented. It usually occurs through infection of the unhealed umbilical stem, particularly when the stem is cut with a non-sterile instrument. As of 1998, neonatal tetanus was common in many developing countries. As a result of a public health campaign, the death toll from neonatal tetanus was reduced by 90% between 1990 to 2010, and by 2013, disease had been largely eliminated. That's why during pregnancy, always 2 doses of tetanus toxoid vaccine is given to pregnant mother. Neonatal tetanus is rare in developed countries. Local tetanus, it is an uncommon form of the disease in which people have persistent contraction of muscles in the same anatomic area as the injury. The contractions may persist for many weeks before gradually subsiding. Local tetanus is generally milder, but it may precede the onset of generalized tetanus, so should be taken care of precautionally. Now, cephalic tetanus, it is the rarest form of disease and limited to muscles and nerves in the head. It usually occurs after trauma to the head area, including skull fracture, laceration, eye injury, dental extraction, and otitis media. Paralysis of the facial nerve is most frequently implicated, which may cause lockjaw, facial palsy, or ptosis. But other cranial nerves can also be affected. Cephalic tetanus may progress to a more generalized form of the disease. Due to its rarity, clinicians may be unfamiliar with the clinical representation and may not suspect tetanus as the illness. Treatment can be complicated as symptoms may be concurrent with the initial injury that caused infection. Now, causes. As we know, it is caused by tetanus bacterium, Clostridium tetani. It is an international health problem as the endospores are ubiquitous. They can introduce into the body through a puncture wound, that is penetrating trauma. Due to Clostridium being an anaerobic bacterium, it and its endospores thrive in environments that lack oxygen, such as a puncture wound. With the changes in oxygen levels, the drumstick-shaped endospore can result in quick spread. The disease occurs almost exclusively in persons who are inadequately immunized. It is more common in hot, damp climates with soil rich in organic matter. Manure-treated soils may contain spores as they are widely distributed in the intestine and feces of many animals such as horses, sheep, cattle, dogs, cats, rats, etc. and chickens. It is often associated with rust, especially rusty nails. Although rust itself does not cause tetanus, objects that accumulate rust are often found outdoors or in places that harbor anaerobic bacterium. The rough surface of rusty metal provides crevices for dirt containing this bacteria, while a nail affords a means to puncture skin and deliver endospores with deep within the body at the site of the wound. And an endospore is a non-metabolizing survival structure that begins to metabolize and cause infection once in an adequate environment. Hence, stepping on a nail, rusty or not, may result in tetanus infection as the low oxygen environment may exist under the skin and the puncturing object can deliver endospores to suitable environment for its growth. So it is a common misconception that rust itself is the cause and that a puncture from a rust-free nail is not a risk. Diagnosis. There are currently no blood tests for diagnosing tetanus. Diagnosis is based on the presentation of tetanus symptoms and does not depend upon isolation of the bacteria, which is recovered from wounds in only 30% cases and can be isolated from people without tetanus. Lab investigations or lab identification of bacteria can be demonstrated only by production of tetanus specimen in mice. Having recently experienced head trauma may indicate cephalic tetanus if no other diagnosis has been made. Spatula test is a clinical test for tetanus that involves touching the posterior pharyngeal wall with a soft-tipped instrument and observing the effect. A positive test results in the involuntary contraction of the jaw, that is biting down on the spatula, and a negative test result would normally be a gag reflex attempting to expel the foreign object. Now, prevention. Unlike many infectious diseases, recovery from naturally acquired tetanus does not usually result in immunity to tetanus. This is an important point. This is due to the extreme potency of tetanus plasmin toxin. Tetanus plasmin will likely be lethal before it will provoke an immune response. Tetanus can be prevented by vaccination with tetanus toxoid. Adults should receive a booster vaccine every 10 years, and a standard care practice in many places is to give the booster to any person with a puncture wound who is uncertain of when he or she was last vaccinated, or if he or she has had fewer than 3 lifetime doses of the vaccine. The booster may not prevent a potentially fatal case of tetanus from the current one. However, as it can take up to 2 weeks for tetanus antibodies to form. In children under the age of 7 years, the tetanus vaccine is often administered as a combined vaccine, DPT or DTAP vaccine, which also include vaccines against diphtheria and pertussis. For adults and children over 7, the TD vaccine, that is tetanus and diphtheria, or TDAP, tetanus, diphtheria, and acellular pertussis, is commonly used. Treatment: mild tetanus. Mild cases of tetanus can be treated with tetanus immunoglobulin, also called tetanus antibodies or tetanus antitoxin. It can be given as intravenous therapy or by intramuscular injection. Antibiotic therapy to reduce toxin production is given. Metronidazole IV is a preferred treatment. Benzodiazepines can be used to control muscle spasms. Options include diazepam and lorazepam, oral or IV. In severe tetanus cases, admission is required to intensive care. Addition to measures listed above for mild tetanus, following efforts are also done. Human tetanus immunoglobulin is injected intrathecally to increase clinical improvement. Tracheostomy and mechanical ventilation for 3 to 4 weeks is required. It is recommended for securing the airway because the presence of an endotracheal tube is a stimulus for spasm. Magnesium sulfate as an intravenous infusion is given to control spasm and autonomic dysfunction. Autonomic effects of tetanus can be difficult to manage. So, IV labetalol, magnesium, clonidine, or nifedipine are given. Drugs such as diazepam or other muscle relaxants can be given to control the muscle spasm. In extreme cases, it may be necessary to paralyze the person with curare-like drugs and use a mechanical ventilator. In order to survive a tetanus infection, maintenance of an airway and proper nutrition are required. An intake of 3500 to 4000 calories and at least 150 grams of protein per day is often given in liquid form through a tube directly into the stomach or through a drip into a vein. This high caloric diet maintenance is required because of the increased metabolic strain brought on by the increased muscle activity. Full recovery usually takes 4 to 6 weeks because the body must regenerate destroyed nerve axon terminals. In short, neutralize the absorbed toxin. IV injection of 3000 units of human tetanus antitoxin is given. Debridement of wound should be done. Control of spasms done. Avoid unnecessary stimuli. Nurse in a quiet room. Injection diazepam IV is given. Any patient with a tetanus-prone wound should receive TIG, tetanus immunoglobulin, as soon as possible. Antibiotics like penicillin, metronidazole are used accordingly. Anticonvulsants, diazepam, phenobarbital are used. Muscle relaxants are used in like baclofen, dantrolene, vaccine, that is tetanus toxoid, is used accordingly. So this was all about the treatment, management of tetanus together with the pathogenesis and sign symptoms. In next lecture, we will discuss some another topic. Goodbye. Have a nice day.